Hi and welcome to today's webinar. Today's webinar topic is top 3 mistakes that people with back problems make that prevent their return to an active lifestyle and how to fix them. Let's see. Okay, so in this master class, I'm going to cover, as the topic says, the top 3 most commonly seen mistakes that people make and some tips on how you can avoid these mistakes so you can be more confident about your spinal health. So moving on, I do have an important announcement to make that I will do at the end of this masterclass today. So make sure you stay with me until the end because you have some good stuff coming up at the end. And also make sure you turn off all distractions because we are going to do some learning and also have some fun along the way. All right, so before we dive into the webinar topic, I would like to remind you and get to the reason why you are attending this masterclass today. You are spending your 1 hour today with me. So let's see who is this masterclass really for. So if it's either you are someone who has had back issues in the past that have never completely resolved, and now you just miss being active and you just don't know how to get there, or you are someone whose back pain is completely gone, but you never tried returning to your active lifestyle, like, running or playing some kind of sport because you're always afraid somewhere in your mind that this pain may come back or it may make your disc problem or your back problem worse. Or lastly, you are someone who has had long-standing back problems and you just want to avoid a spinal surgery in the long run. You're looking for some lifestyle changes, some lifestyle tools, some things that you can be doing on your own so you make sure that you do your best to avoid any unnecessary spinal surgery. So if you are either one of these, you are absolutely at the right place. And let me know in the comments, which one are you? I would love to know. I would be interested to know. And I'm going to open up my chat to be able to do that. Here we go. Okay, so I see a lot of 2s and 3s in the comments, which is good, okay, lost you. Okay, I see a lot of 2s and 3s in the comments coming up. Okay, let me reset the recording. Can you hear me now? Can you hear me? Can you hear me? Can you hear me?
Hey, couldn't hear you.
Everything is exactly the same. Can you hear me now?
Yes, I can hear you now.
Okay. Okay, moving on. So let's get started with today's master class. I would like to introduce myself real quickly, especially to those who have never worked with me one-on-one, give you a little introduction about myself. So my name is Taruna and I'm a licensed physical therapist, and I have done my advanced specialty training in this form of treatment called the McKenzie method, which is a world-renowned evidence-based system for assessing and treating spinal disorders. And I've also completed my advanced training, and I'm a recognized fellow with the American Orthopedic Manual Physical Therapy Association. And over my years of practice, I have helped thousands of patients and people with back problems, and I've seen them, successfully return to a lifestyle of their choice, help several people avoid surgery, identify, candidates who are a right fit for surgery so they can get the right care early on, And this is just something that I really enjoy doing. And I'm also a new mom, a C-section mama, and I have used my own principles to help my own recovery after having my baby. So I basically, through my practice and through my online programs, my whole vision is to help active adults recover from spinal problems, help them get back to an active lifestyle, and help them avoid an unnecessary spinal surgery, which is also the theme of this masterclass. So I've been doing this for a long time, and this is what I enjoy doing on a daily basis. All right, so what are we going to cover in today's masterclass? We've already talked about this, the common mistakes, how you can avoid those, lifestyle changes, how you can work with me, and then I'm gonna stay back for some Q&A. Okay, so before we dive into the three mistakes, it's important to just kind of quickly and briefly review what your spine looks like. So this is how your spine looks like. It's like a full ladder starting all the way from your head down up to your tailbone, and your spine is divided into three portions. As you can see, different colors represent different portions of your spine. Your cervical spine is the white portion at the top. Then you have your thoracic spine or the middle back. And then you have your lumbar spine or the lower back in green at the bottom. And then the orange is your sacrum or the sacrum coccyx or your tailbone. So this is how your spine is broken down. And then within your spine, like a zoomed version of your spine, this is what it looks like. You have your two vertebrae, the two bones that form the basic structure of the spine. You have a jelly-like disc in the center. The outer ring of this of the disc is called as the annulus, and the middle central fluid portion is called as the nucleus. So the role of these discs is to basically act as shock absorbers and to provide some mobility in your spine. And that's why when a lot of people experience spinal stiffness, your discs are often involved because they are a big contributor to your spinal mobility. And also your disc is very rich in nerve endings, because of which it is a very common culprit for your back pain and pinched nerve type of problems. So your disc is essentially one of the very important components of your spine, if not the most important. Okay, moving on. What are some of the movements that take place in your spine? So here we are talking specifically about your lumbar spine or the lower back, since that's what this master class is dedicated towards. Your spine moves in, four primary directions. And the reason I'm talking about this is when we do any type of movements or exercises, I often see people put a lot of focus on what muscles they are strengthening. They think about strengthening their core, strengthening their quads or their hamstrings, or which muscle they are stretching, if they're stretching their hamstrings, quadriceps. But a lot of people don't really pay attention to what's happening at the spinal level with these movements or exercises. So just a quick recap of how your spine moves. Your spine moves in your forward bending or flexion position. It also moves in the opposite, that is the backward bending or extension position, as you can see here. Now, when you go into flexion or forward bending, it opens up this space between the two vertebrae, as you can see, and it also allows your jelly, your disc jelly, to move backwards like this. And the exact opposite happens when you go into extension or backward bend. You see these two vertebrae come close together and the jelly of your disc moves forward. And when you go into side to side or lateral movements, the same type of response happens, on both sides. So this is how your vertebrae, your spinal joints, your disc moves when you go through different movements and positions. Something to keep in mind when you're doing different types of exercises to see what impact it has on your discs and your spinal joints. All right, so we can dive into the meat of today's masterclass. and talk about the three mistakes. The first most common mistake that I see people make is trying too many things at once. And I know that it's not so much the people to blame because there are so many options out there when it comes to solving the problem of your back pain. I mean, back pain is a $1 million-trillion industry. There are so many products that get sold in the name of solving your back problems, may it be mattresses, lumbar pillows. There are so many different types of services that you can use. You can see an acupuncturist, a chiropractor, physical therapist, massage therapist, you name it. There are so many providers you can work with. So people, of course, have so many choices and so many options when it comes to solving their back pain problem. And I think that's where, so many people get stuck. They do not understand which provider, which service, or which product is going to be the best fit for their problem, and they do not stick with that service, the provider, long enough for it to have a fair shot, and they keep switching between all these things, spending a lot of time, a lot of money, a lot of frustration builds up. I mean, if I had a nickel for every time a patient asked me, what else can I try to solve my back pain problem in addition to working with me, I would be a millionaire and I would be ready to retire. And I get it. I get, the desire to get better really as fast as possible, do the best you can in order to get yourself back to full function when you are in pain. But a lot of times the best thing to do is to slow it down, to stick with one plan and to give your body the time and the environment to heal. And why is that? Because most of the problems that happen in your spine, they take a long time to develop. They don't just develop overnight. Even though it may seem like that to you, these problems have been, slowly developing in your ligaments, in your discs, in your other tissues, years over years over years, and you've probably just been ignoring them. And one fine day it blows up on you, and that's when you decide to do something about it. So the same process happens when your spine is trying to recover. The technical term for this is called as the creep phenomena, where your soft tissue is gradually moving, going through certain changes. So for that creep phenomena to happen, it has to take a certain number of weeks for it to heal if you give it the right environment and the right conditions to heal. So a lot of people don't wait for this creep phenomena to set in and they are ready to move on to the next thing. And I think that's where things kind of fall out of the wagon. You can take a quick sip of water. All right. And let's move on to mistake number 2, doing too much too soon. So this is a very common one also, and this is someone I see a lot more with the people that this master class is for, is the active adults, is adults who really enjoy their active lifestyle, and I am one of them. I would be just as much as guilty if I didn't do this for a living, is trying to return to an activity way before you are ready for it, or just returning into it full swing, like going from couch to 5K without having a strategic plan for it, and then having your discs, your spine, your ligaments, your facet joints fire back on you because you just kind of threw them into the deep end of the pool. So this is a common pitfall a lot of people fall into, is they try to return to an activity, just full blown, without following a step by step plan, without having the right guidance as to how to progress, how much to progress, and not knowing when to stop. Yep. So like I said, trying to return to an activity before you are ready. So I'm going to share an example here of this patient that I worked with. I'm going to call him Mr. John for the purpose of this master class. 42-year-old, active guy, diagnosed with the L4, L5 herniated disc. and he had fallen into the same pitfall because he was very motivated to help himself recover and get back to being active. So was working on core strengthening, getting epidural injections, as well as chiropractic care all at the same time, just which just didn't give him the right focus and the right environment to heal. So when we met for an assessment, we kind of broke things down for him, gave him a more strategic plan of action to work towards, and with his high levels of motivation, in 8 weeks he was able to return to his fully active lifestyle and having the tools, knowing which movements are going to be right for him and which movements are going to harm the spine. So you can watch the full video of this case study. I'll put it in the chat link later, and you can watch it if you're interested to learn more. All right, moving on to the third mistake. This is not so much a mistake as an observation that I have made, is people are just unsure about what movements will help or hurt the spine, which is totally understandable. They are not movement experts. They've just been given this random advice, go be active, go try an exercise class to help your disc problem, or just go lose some weight. And that's very general blanket advice for a problem like back pain. People need more specific guidelines than that. And in order to support this statement, there is a research study that was done in 2012, in which it was clearly identified that when people with back pain and sciatica, they follow the right movements, called as the directional preference movements, they respond very well and they recover very fast in about 6 to 8 weeks, if their discs are in a state to recover, of course. And the people who didn't follow the so-called right movements or the directional preference movements did not do well even after 6 to 8 weeks, or even got worse. So this goes to show that yes, movement is medicine when it comes to your back problems, but you also want to know which is the right medicine for you and what is the right dosage of that medicine. If you have, fever or a certain type of viral infection, you want to take the right antibiotic for that infection. You don't want to just pick up a random pill that you find in a drugstore. The exact same thing applies to movements when it comes to recovery from your back problems. And there is a lot of research and a lot of data to support this statement. You want to follow your directional preference movements that are the right ones for your spine, and working with the right provider, know exactly the right dosage of movements, and that will be your recipe for success. Another common similar pitfall in the similar area is repeated movements, too many movements in one direction, which is commonly seen in certain sports like golfers. They tend to, go for a lot of rotational movements, and they tend to be typically in one direction. And your joints don't get enough of a counterbalance of movements in the opposite direction, which is what creates a lot of these problems. And again, the general advice, the blanket advice of go do some exercises or go move your spine or go get active is to blame, because people then don't know how to move their spine or how to get active or how to move. So this is the third most commonly seen pitfall, is the lack of clarity around movements. And I would like to share this example or case study. This 20-year-old young kid, we'll call him Mr. A. He was diagnosed with bulging disc, and very active, very motivated guy. And he had tried stem cell replacement, physical therapy, acupuncture, chiropractic care. And his pain was very much controlled, but every time he tried to return to activity, his pain would flare up, and he would just stop the activity completely. And after going through this process a few times, he was just scared to return to movement after that, because he was unsure about which movements or sports were helping his disc and which were not helpful. So after we worked together and he got the tools to know exactly which movement is helpful for him, how could he know if this movement is helping or hurting, he was able to slowly, he took those tools, slowly returned back to a fully active lifestyle in about 8 to 10 weeks. And he did amazingly well too. And you can watch his case study as well. I will link his YouTube video in the chat, and you can watch his full case study if you're interested. All right, so just for fun, what would be the number one activity of choice that you would like to return to if your pain magically disappeared? I would be interested to know. So let me know in the comments. Let's see. I see a couple of golfs. I see running. I like it. Pilates and yoga. That's a good one. That's exactly the type of activities that are good to sustain in the long run, that are good for a lifestyle change. If you want to, continue to stay active and stay healthy, and also things you can enjoy. Workouts. Ron says working out in the gym, and that's a good one too. So now, wait, why did I go a slide behind? Okay, so let me ask you this. Would you like me to help you to return to an active lifestyle without worrying that it would make your back problem worse? Yep, I'm looking for some answers in the chat here. I'm looking at some yeses. I like the yeses. Okay, so whether you've replied yes or whether you haven't replied at all, you have really two options to go from here. Whether you want to return to golf, running, yoga, or Pilates, you can go about this on your own, being unsure about what movements will help or hurt your spine, and take the risk of that not working, or, maybe working sort of brokenly. Or you could gradually return to an active lifestyle with a step-by-step proven roadmap while keeping your spine healthy. Now, before you say anything else, I want to, if you are thinking about the option number 2, you are invited to join my online group called the Healthy Back Blueprint for Active Adults. So what is this Healthy Back Blueprint? It's an online course that I have put together in which my goal is to help you go from feeling anxious and confused to feeling confident and empowered as you learn how to have a healthy spine while returning to an active lifestyle you've always wanted. What do I cover in this online course? It's a 5-week online program that I will be teaching live this time via Zoom. And the program includes the educational classes components where I will teach you how you can take charge of your spinal health to get back to the activity of your choice and to avoid this unnecessary spinal surgery. And you get access to all your support PDFs and videos along the program that are included in the course. So what are the different modules? Each week we cover different areas. The first week we are talking about the big picture of back pain and sciatica. Second week we are talking about range of motion. Third week, your step-by-step guide to return to an active life. Fourth week, we are talking about a big one, which is your posture workshop, which is one of the most common area where a lot of people struggle with back pain. And the last one is where everything comes together, where we talk about the lifestyle changes or tools that you can have and you can do your best to help avoid that spinal surgery. And then along with these 5 modules, you get access to some amazing bonuses. Your first bonus is your weekly live Q&A, where I answer all your burning questions as you are going through the modules. You can ask these questions either live during the class, or you can submit them beforehand and I can get to them during the class or via email. The second bonus that you get is your weekly movement class after each module. This is a really great bonus where we break down after the class into a movement class and go through your spine safe movements or exercises. And because this is a small group, you will, I will be able to keep eyes on you and make sure that you're going through your movements, and as you're working through the program, nothing is really flaring up your problem. So you really get more hands-on coaching with this bonus. And the third bonus is our very much in demand healthy spine during long flights workbook. I have helped so many people. I have seen so many patients have develop an acute flare up of either back pain or sciatica after they've been in a long flight. And I know no one is taking any long flights right now because of the pandemic, but trust me, once things open up and you get back on those long flights, you are going to be so thankful that you have this guide, because I have seen numerous people develop back pain episodes after being in flights, after sitting in the flight for so long, having to lift heavy suitcases, just sitting and waiting at the airport, being in those crunchy leg rooms, and typically followed by car rides trying to get to your destination. It is a complete recipe for back pain. So this is my complete guide where I give you all the tips, what postural pillows you can use, what movements you can do during the flight, at the airport, once you get to your hotel, hydration guidelines, everything put together in one guide. So these are the amazing bonuses that you get with the program. And the total cost of the program is $14.90, but because this is the first time I'm doing this program live with my own patients, I have done this type of programs before with corporate clients, but because I'm doing it with my patients, the price for you is $399. And in order to make it easier for you, you can also break it down into two payments of 210. So if you're interested, if this presentation sounds like someone like you, if you feel like these are the pitfalls that you find yourself falling into, just go into the URL healthwatcherspt.com/healthyback, and you can apply for the program, because like I said, the spots are limited and I want to really have the right candidates participate in the program. If I feel like you are not the right fit for whatever reason, if it's not going to benefit you, or if you are someone who needs one-on-one care or something else, I will let you know, and you won't be taken into the program. But I want this program to reach as many people as possible, because I know it's a big chunk of people kind of hanging in between, where they don't necessarily need the one-on-one care, but they are also not back to their fully active lifestyle yet. So I'm closing the enrollment this Friday, August 27th. And that is because I want to put together everything for the group that I have. And I'm starting the classes first week of September, first Friday of September. And all the weekly modules are going to be taught live on Fridays at 10 a.m. Eastern and 7 a.m. Pacific. So I need those few days in between to prep everything and start sending out emails to my group. So if you are sitting on the fence, or if you need some time to think about it, you want to enroll in before Friday, August 27th. And like I said, the URL is healthwatcherspt.com/healthyback. So now time for some Q&A. So I'm going to go ahead and answer some of the questions that I received through Instagram DMs when I put out the question thing up. So I'm going to answer those first. So one of the questions I got was, someone was interested in the program, but they said they have too many commitments and they did not have the time to attend the course in September. And I get that. I get that life can be busy sometimes, but because there is so much work that goes into putting a group program, an online course like this, I will not be teaching it again the rest of this year. The next time the program will be taught will be January 2022. And personally, I wouldn't procrastinate, doing something like this until next year. All the workshops are live every Friday for 1 hour. So it's not a lot of time commitment on your part. It's just 1 hour a week. And if your health is anywhere on your priority list, I don't see why you cannot make that time happen. And it's only for 5 weeks. So it's not a huge time commitment on your part. Plus, you log in via Zoom, so you don't have to travel. You can be in your home, nice and comfortable when you attend all the workshops. Second question was they weren't sure if the program will work for me because they've tried so many treatments and nothing has really worked for them. And I get it. And that's why I said I am very meticulous about who I'm enrolling in this program to. So once you go to the URL and if you meet the criteria we talked about earlier, you still just apply for the program. And if you are enrolled by us, then you're definitely the right candidate for the program. And it will empower you and give you the tools that you need to have a healthy spine. Now the rest is up on your shoulders if you follow the proven roadmap and take yourself to success. We can only do so much in helping you get there. There is some amount of you taking charge of your health as well. And another question was, will this program help me avoid spinal surgery? Like I said, if you are someone who is not a candidate for spinal surgery, which is a lot of people with back problems, I've got you covered because we are talking about all types of lifestyle changes that you need to make in order to, do your best to avoid that unnecessary spinal surgery. It's all included in your module 5. Plus, it's the underlying theme of the whole program. It all just comes together in module 5, where I spell it out for you step by step. Uh, like I said, lifestyle changes, tools you have, and things that you can do to minimize the chances of a surgery. Of course, something unforeseen happens, you get in an accident, you fall off a tree, unavoidable, unforeseen things happen all the time. Okay, so thank you so much for your time today, and I'm hoping to see some of you on the inside. Don't forget that the enrollment is closing this Friday, August 27th, and the URL is healthwatcherspt.com/healthyback. Hope you enjoy the rest of your week.